Good afternoon, respected judges, seniors, and my dear friends. I am Dr. Sanam Shah, third year resident in the Department of Anesthesiology at SBKS Institute and Research Center. Today I am going to read a paper titled An Observational Study of Intravenous Dexmedetomidine and Clonidine for Attenuating Haemodynamic Response to Laryngoscopy and Intubation in Patients Undergoing General Anesthesia under the guidance of Dr. Jayashree Desai Ma'am, Professor at SBKS Medical Institute and Research Center. Starting with introduction. General anesthesia is a drug-induced reversible condition composed of four behavioral and physiologic states, that is unconsciousness, amnesia, analgesia, immobility and stability of the physiologic systems, including the autonomic, cardiovascular, respiratory and thermoregulatory systems. Manipulation of the airway, particularly laryngoscopy and endotracheal intubation, alters cardiovascular physiology both via reflex responses and the physical presence of an endotracheal tube. Many non-pharmacological and pharmacological methods have been tried by various authors to attenuate the cardiovascular response to laryngoscopy. None of these agents or approaches have proved to be ideal. Hence, the search for an ideal agent to attenuate hemodynamic response is still continuing. Starting with introduction. General anesthesia is a drug-induced reversible condition. The aim of this study is the comparison of hemodynamic effects between dexmedetomidine 0.5 microgram per kg and clonidine 1 microgram per kg during and after laryngoscopy and tracheal intubation for patients undergoing general anesthesia. The objectives are to compare hemodynamic changes after laryngoscopy and intubation and also to compare the side effects and safety of dexmedetomidine and clonidine. Material and methodology. This observational study was conducted at Dheeraj General Hospital after clearance from the ethical committee. Written and informed consent from each participant was taken. The 60 patients were divided equally into two groups. That is, Group D received 0.5 microgram per kg per body weight of dexmedetomidine intravenously, and Group C received 1 microgram per kg body weight of clonidine intravenously. Pre-medication was done with injection glycopyrrolate 0.2 mg intravenously, injection ondansetron 4 mg intravenously, and injection ranitidine 50 mg intravenously. Pre-oxygenation with face mask with 100% oxygen for 3 minutes was done. Group D patients were given IV dexmedetomidine 0.5 microgram per kg diluted in 10 ml normal saline over 10 minutes, and Group C were given IV clonidine 1 microgram per kg diluted in 10 ml normal saline over 10 minutes, each given via syringe infusion pump. After 5 minutes induction, the intravenous 2.5% thiopentone 5 to 7 mg per kg and succinylcholine were given to facilitate endotracheal intubation. Maintenance was done with oxygen, nitrous oxide, 1 mac of isoflurane and injection vecuronium bromide 0.08 mg per kg as initial dose and 1 mg as and when required. Reversal was done with injection neostigmine 0.05 mg per kg and injection glycopyrrolate 0.008 mg per kg. Extubation was done after fulfilling the recovery criteria and shifted to recovery room. The parameters which were studied were the hemodynamic responses would be compared in both the groups by measuring heart rate, systolic blood pressure, diastolic blood pressure, mean arterial pressure. These parameters were measured using automatic multipara monitor at following intervals. That is, before giving the test drug, that is the baseline values, after the end of infusion of study drug, after induction of anesthesia, after laryngoscopy, during intubation, after intubation at 1 minute, 5 minute, 10 minute and 15 minutes. Inclusion criteria is the adult patients aged between 18 to 60 years posted for elective surgeries under general anesthesia, patients belonging to ASA class 1 and 2, no known history of allergy and hypersensitivity to study drug, patients willing to sign informed consent. Exclusion criteria contains age less than 18 years and more than 60 years, patients belonging to ASA class 3 and above, patients with hypertension, cardiac, renal, hepatic and cerebral diseases, patients with difficult airway and obese patients, patients with endocrinal diseases like hyperthyroidism, hypothyroidism and diabetes mellitus, patients coming for emergency surgeries, pregnant females, known allergy to the study drugs, and patients on beta blockers. Results were in the heart rate wise distribution. The pre that it showed that the pre-induction values of heart rate were comparable between the two groups with no significant difference. The rise in heart rate is is highly significant in group C, which is clonidine, in the first 3 minutes after intubation, compared to group D. The heart rate, however, returned to baseline at 10 minutes after intubation. Systolic blood pressure. In the present study, both the groups, that is the group D, that is dexmedetomidine, and group C, clonidine, was statistically not significant in basal and after infusion of study drug. After that, from induction to intubation, systolic blood pressure was significantly increased in both the groups. Then it was decreasing as per time went out respectively. However, the systolic blood pressure continued to be at lower levels compared to the basal value even after 10 minutes of intubation. In the present study, in both the mean arterial pressure, in the present study in both the groups, that is group D and group C, the mean arterial pressure was statistically not significant in basal and after infusion of study drug. After that, from induction to intubation, mean arterial blood pressure was significantly increased in both the groups, then decreasing as per time went out respectively. However, the systolic blood pressure continued to be at lower levels compared to the basal value even after 10 minutes of intubation. Discussion. The hemodynamic responses to laryngoscopy and intubation, comprising of elevation in heart rate and rise in systolic and diastolic blood pressure, are well known. The potential for life-threatening complications associated with these responses is also well documented. Traditionally used drugs like lignocaine, fentanyl, clonidine, esmolol, etc. are either not fully effective or are associated with considerable side effects at doses required to attenuate these responses. Therefore, it has become imperative to develop a novel technique or drug to prevent these potentially hazardous responses. The mean baseline heart rate, systolic blood pressure, diastolic blood pressure, and mean blood pressure were similar in both the groups. The mean baseline heart rate in group D was 84.03 plus or minus 7.04, and in group C was 83 plus or minus 7.57. The difference in pulse rate was not significant as shown by a p-value of 0.7236. Similarly, mean baseline systolic blood pressure in group D was 123.13 plus or minus 5.85, and in group C was 123.83 plus or minus 5.91. The difference in mean systolic blood pressure was not significant as shown by a p-value of 0.64. For diastolic blood pressure, the mean baseline value for group D was 85.16 plus or minus 5.76, and for group C was 85.6 plus or minus 6.1. The difference in mean diastolic blood pressure was not significant as shown by a p-value of 0.77. Baseline mean blood pressure was also statistically similar in both the groups. But thus we find that the baseline variables in two groups were similar and can say that the randomization was done adequately and we are able to achieve the desired study and control population. Baseline mean blood pressure was also statistically similar in both the groups. Thus we find that the baseline variables in two groups were similar and can say that the randomization was done adequately and we were able to achieve the desired study and control population. Acceleration of heart rate related hemodynamic response to tracheal intubation was observed at all measured time points in both dexmedetomidine group as well as clonidine group. There is significant rise in heart rate in clonidine up to 3 minutes after laryngoscopy and intubation from baseline values when compared to dexmedetomidine. The return to baseline in heart rate values does occur at 5 minutes after intubation in both the groups. Arora et al. Have studied this significantly higher heart rate in clonidine group last up to 3 minutes after intubation, but 1 minute after intubation there was no statistically significant difference in heart rate between two groups. There is rise in systolic blood pressure in both the groups post intubation, but the rise in systolic blood pressure was significantly higher in clonidine from the time of laryngoscopy till 15 minutes after that. The return to baseline value of systolic blood pressure in both the groups was achieved at around 5 minutes after intubation, which was similar to studied by Sarkare et al. There is significant attenuation in diastolic blood pressure caused by group dexmedetomidine in the immediate post-intubation period compared to clonidine group. This attenuation continues till 10 minutes post-intubation period. However, the degree of attenuation in diastolic blood pressure after 15 minutes of post-intubation period is comparable between the two groups, which was similar to study uh, conducted by Sarkar et al. However, CM Suryavanshi et al. Have found in contrast study where immediate infusion of drug to post-intubation at 1 minute have found systolic blood pressure significant between both the group D and group C, while diastolic blood pressure was significant only at post-intubation at 1 minute. There is significant increase in mean blood pressure in clonidine group in the immediate post-intubation period compared to dexmedetomidine group. The significant attenuation caused by dexmedetomidine group lasts for up to 10 minutes post-intubation period, after which the difference in mean blood pressure values are comparable. The baseline values of mean blood pressure are achieved in the NTG group at around 10 minutes. Our findings correlate with studies conducted by Sarkar et al. And Sharma et al., Suhasini Rajshekhar et al., and Ahmad ALM et al. That dexmedetomidine is better in attenuating mean blood pressure response to laryngoscopy. Side effects and complications. There were no incidences of hypotension, bradycardia, nausea, vomiting, and bronchospasm in our study. Conclusion. From the basis of a study, it was concluded that IV bolus dexmedetomidine of dexmedetomidine 0.5 microgram per kg administered prior to laryngoscopy and intubation can attenuate the sympathetic response without any major side effects of the drug in otherwise healthy patients undergoing elective surgeries under general anesthesia. These are the references of my study. Thank you.